Oh, let me introduce myself a little bit before we get into the process and really start talking with our excellent panel this morning. So, my name is Christopher Wilson, and I am a longtime Phoenix since 2008, but also I currently work as a disparity study manager for the state of Oregon. And what that means is I look at historical disparities in the procurement systems that are hard boiled in our various systems. And so the goal ultimately is to correct these historic disparities, but we have to do it through a research process and through a study that we do specific targeted interventions to address disparities. And so, really, a culmination of my leadership, my experience working in healthcare, working in these different aspects, really have prepared me to be here and to hopefully moderate this these talks successfully. So let me start to introduce some of our panel. And so our first panelist, Dr. Brinkman, please introduce yourself.
Good morning or afternoon, depending on your location. My name is Mary Jo Brinkman. I am the Senior Compliance and Privacy Associate and Clinical Risk Manager for an acute care hospital. In addition, I have been on the active faculty and taught for the University of Phoenix since 2003 in the Doctor Health Administration program and in healthcare services. I've also had experience as the director of quality, where I was appointed to a task force for quality and risk management within 32 hospitals. I have been responsible for the Joint Commission surveys and accreditations for about 15 years. I've received awards with the hospital or helped the hospital achieve rewards with the Arkansas Foundation for Medical Care. And just in summary, I am very passionate about the hospital being compliant with the documentation of medical necessity and with accurate billing and improving health care, the care of the patients um, with quality and safety. Thank you.
Thank you, Dr. Brinkman. Here, our next panelist, Tilly, please introduce yourself.
Good morning, everyone. Good afternoon as well. Thank you. First of all, I'd like to just say I'm honored to be here with you all today and asked to come and speak with you all. And I'm trying to figure out between Chris and the others to say, why am I here? I'm trying to figure that out as well. So let me just tell you a little bit about myself. I've been a nurse for 30 plus years. And I served majority of that bedside nursing was in the Phoenix area. I now live in San Diego, but I'll tell you how I got to San Diego in the meantime. But I pretty much grew up being a nurse in Phoenix, Arizona. And one of the things that I did was I've always been honored to make sure that we had the best patient care possible. And at one point in my career, I felt that I would kind of complain about my colleagues, and I took a good look at myself and said, quit complaining about them and do something. So I decided to go to the local community college, Maricopa system, and became a faculty member and created nurses. So I got into the pipeline of making our nurses for the city and decided that that was a way to provide that patient safety. And along the way, it just became one of those types of things that became addicting. And after becoming a faculty member, I decided to kind of play in some administration parts there, became a department chair, eventually became a dean within the Maricopa system. Next thing you know, I'm moving along and decided that I wanted to move a little higher up into higher education, and I became a vice president of instruction here at San Diego City College. I would like to mention that I am the first and only female Latina that has achieved this role since 1914. And so that is an honor for me, as well as trying to help myself and others learn what does that really mean. So hopefully today I can address some of these questions that we have from that perspective as well. Thank you.
Thank you, Tilly. So then we have Mr. Reggie Grigsby. So please introduce yourself, Reggie.
Good day, everyone. I'm not sure if I'm speaking to East Coast or West Coast time, so everything's good day. Reggie Grigsby. I am currently in my 39th year of law enforcement service. I'm currently serving as the Chief Special Agent for the Arizona Attorney General's Office. As such, I am a political appointee, and I'm responsible for all criminal investigations conducted by our office. And just by way of explanation, we do everything from public corruption to transnational crimes, as well as healthcare fraud and abuse and any major fraud involving $100,000 or less, as well as election integrity. Prior to coming here, I worked extensively in San Diego and Oceanside, California police departments. I've also had the pleasure of serving my country in the Army for 3 years. I served overseas in Europe, where I had already taken some foreign language skills. And that paid off by virtue of the fact that as a law enforcement officer, I've also served our country on foreign soil. So leadership and management has been my two strong suits, and something that I really take to heart is diversity, equity, and inclusion. So I'm glad to help out and share my experiences, and also at the same time learn something from this. I'm a former campus college chair for the University of Phoenix here at the Phoenix campus. And at one time, I was also adjunct faculty.
Thank you, Reggie. And Reggie's one of the best colleagues that I know and I've worked with, and so I just appreciate the fact that he's here. So, Kevin, please introduce yourself.
Hi, everybody. Good morning or good afternoon, wherever you are. I'm here in Chicago, and thankfully the sun is out today. I'm an outreach specialist too here at Blue Cross and Blue Shield of Illinois. I am in my second year of serving the Illinois state through our Caravan program. I oversee and take the lead on our fleet of mobile health and wellness programming that provides screenings and no-cost vaccinations across all 102 counties. Previously, before this, I actually started at one of the inaugural Walmart health clinics that was located in Chatham here in Chicago. One of what a lot of people like to call under-resourced, I like to call an area of opportunity. And before that, I worked in lung cancer screening, supporting Medicare populations to get screened at the University of Chicago. And then before that, I left an amazing job at Malcolm X College, where I was over our federal grant program supporting African American males going into allied and healthcare fields. And the reason I say I left that amazing job was because during that time at Malcolm X, I was one of those Black males who wanted to do a little bit more in the healthcare field, and I decided to take their medical assistant program to complement my bachelor's from the University of Urbana-Champaign. And then I did my externship and I got my RMA. And then I chose to go a little bit further, and now I'm a candidate here at the University of Phoenix in the Master's of Healthcare Admin program. So I'm super excited as an emerging leader to share some of the experiences that I have had, as well as learn from everybody, from panelists to invited guests, and really have a great time. So thank you so much for allowing me this opportunity.
Thank you, Kevin. It's really cool to get to know you and hear some of those experiences. It's you're right in the mix there in the Midwest, so we'll have to talk more about that. So, and then we have Dr. Tommy Tunson. So please introduce yourself.
How you doing? Trust everybody's well. Thank you so much, Chris, for narrating this. This is awesome. And I need to give a little bit of props before I continue with my introduction. Reggie Grigsby is not only who he is there, but Reggie is an Army Airborne Ranger graduate, and that's a big deal in the Army. So I wanted to give props to him that he did that, and he served, and he made officer. Reggie was an officer in the Army. That's a big deal as well. Leadership. I currently am a professor of criminal justice at Bakersfield College. I currently teach a full-time professor. I created transformational policing model that we'll probably talk about later in this broadcast. And this model helps law enforcement throughout the country and the communities. Before that, I was a chief of police in 4 cities in California. It really feels good when you ascend to the level of chief of police, but as others know, there's some issues that come along with being a chief of police because the buck does stop at you, and it's real interesting. Achieved the rank of colonel in the Army, so I know a little bit about leadership, having served in the Middle East and different conflict zones throughout my career. And I coached football back in the day when I had some time, but this professorship and what I'm doing now is the best. Received a lot of different training. I'm a published author now. I got a couple books coming out, and I'm looking forward to this venture today. I started teaching for University of Phoenix in 2000, so I've been around a minute, and now I'm back as a full professor with a retired police chief and Army colonel under my belt. Thank you.
Thank you, Tommy. So that's the end of our introductions for our panel. And so we're going to get right into the questions. And I'm so pleased to have a panel that really walks their talk. That's been the key to each one of your introductions. And that's so interesting. I wanted to comment more, but let's just start with the first question. And so we're going to start with Dr. Brinkman. So what do you think, or what do you see as the biggest disruptor in your field or place of work during these tumultuous times?
The pandemic is easily the current biggest disruptor of work in the healthcare field. In healthcare, we feel like we've been on a roller coaster. We just think we made it to the top and have decreased the number of COVID-19 diseases, when the bottom falls out and we end up facing coronavirus variants such as the Delta and Omicron.
Anyone else want to weigh in on that? Yeah, go ahead, Kevin.
Oh, sorry about that.
No, it's all good.
I agree with Dr. Brinkman. I think that, we are on this roller coaster, and as all of us know in healthcare or social services, the complexity of the field continues to change. And that's always something we've had to come accustomed to. But in those moments of change, really coming back to looking at like, what was that initial problem, and why haven't we addressed that? Oftentimes I feel like in certain settings, we put Band-Aids over things, and then we're like, oh my gosh, that was great, goodbye. And we did it, and now we have to go tackle COVID. But we still have people who have chronic illnesses who are still vulnerable. And how do we address that? So I think that's still one of the biggest disruptors, as well as resources. And on my side of the house, human capital. I feel like there is a true war on talent, and it is so hard to either retain or attract talent and bring them in and, do the good work that we need, because these shortages are crazy. So I think that's the biggest disruptor.
Yeah, Tilly, I was about to come to you. So what have you seen, especially in nursing practice, as one of the biggest disruptors? Because we've seen everything in the news, and we've seen things happening all around us. A lot of us have experienced this in 3D with our family members, falling ill or having to go to work or dealing with those things. So what are you seeing in your practice, especially as regarding nursing leadership, and hospital leadership?
Well, there's several things. I definitely agree with Dr. Brinkman and Kevin. And I think between the two, they talked about human resources, and that's a big one, right? Shortages, demands, the demands are so high. People are changing their minds. Do I want to have this type of career or not? I was fortunate enough to have been in nursing for so many years, and I wouldn't change it for anything. And today, for me as a leader, I many times struggle. Do I turn in my administration hat and go work on the front lines because I feel like I'm needed and my experience can help with others? But then that's just one. How many more can we get there? And it's a really, really difficult time for individuals. Individuals, they're sacrificing so much on the front line to be out there for people, for all of us, and to help us. And that's been a really difficult space there. What I wanted to add, if I could, to that is the mindset of the workers too, right? In part of that. And in this time in our lives, we find this line that divides people, and people want to be heard and need to be heard. Everybody has a story. Everybody needs to be heard on that level. And somehow there's always going to be some winners and some losers on both sides. But I think if we can really try to listen into each other, how that works. I mean, whoever thought, I never thought in all the years I've been here, taking a vaccine or not would cause so many issues in this country. And so I'm trying to be very careful about how I'm going here in this information, but it really is a big disruptor in, I think, all of our lives, right? And where we're going with that piece of it. I'm not sure that I actually have any thing to pull back for it more than just to put it out there. And maybe that's something that we can just keep in mind as we continue to have the conversation today.
Thank you.
Chris,
Reggie.
from a law enforcement standpoint,
yes, sir.
From a law enforcement standpoint, we kind of anticipated something would occur, and thank goodness for the excellent behavior, the conduct of the first responders of the nursing facility. I can't thank and commend them enough. I just can't believe it. But I will tell you that our problem in law enforcement was primarily what happened with the racial divide in America at the same time during the pandemic, because the hospital was in the hospital handling their business and doing it absolutely exemplary and excellent. But then we have to deal with the pandemic in the streets firsthand before we really knew what was going on. And that made it extremely difficult, because then we had the social conflicts nationwide that we had to deal with across the country. I will also share with you, and Reggie Grigsby will probably know this as well as anybody, we anticipated a pandemic years ago in the Army. We knew that there was something brewing and there was something going on, and we trained for it. In the Army, we trained for it. When I was in the Middle East, we trained for chemical biological warfare. Unfortunately, never thought it would ever come to this country, never thought it would happen. And just for a little light for everybody, and Reggie remembers as well, we had to carry our shot cards that showed vaccinations every single place we traveled in the world. So it's the new normal, but that's from a law enforcement standpoint.
You speak truth, Tommy, because 15 years in the military myself and in the Army, so you're speaking truth. And so, Reggie, I would like to hear your unique perspective on this, because I know that you're in the mix there in Phoenix, and I know there's all kinds of things locally happening. I was paying attention to a lot of that, especially what was happening in 2020, and really moved me. So please, what are your perspectives of some of the disruptors that happened during this time of the last few years, and how that's affected your work and your approaches to leadership and to what you do?
Well, first, I want to, I'm not sure how to refer to Mr. Tucson there as chief or as colonel, having accomplished both. So, but I know that as a military man, he'd much rather be referred to by his military title than anything else. That's the part that's most important to him. So forgive me if I refer to you as colonel from this day forward there, colonel. But I think that one of the biggest disruptors of leadership and management style, quite frankly, during tumultuous times has simply been the lack of leadership. I think that what happens is, and this is one of the questions that is how do you manage or prepare for tumultuous times? Well, you lead when there's non-tumultuous times. You manage when there's non-tumultuous times. It's kind of like being a SWAT team commander. You have to have your teams ready to roll and deal with contingencies when they plan. Going back to what our friend Ms. Chavez said when she made a point, the big debate about whether or not, we should be taking vaccines, whether or not, people should be engaging in those practices identified by the CDC that would minimize the likelihood of the pandemic, further expanding and then, getting to the point where we have these mutations and on and on. But I think that for me, my leadership style never changed. Transparency, honesty, pushing decisions down to the lowest level of the organization, being true to what you stand for and putting others first. Those are the ways that you get through crisis. As anyone who's ever been in the military or been on a SWAT team can tell you, you don't control critical incidents. During tumultuous times, you don't really get out and you put your finger on the pulse and you manage it. You identify objectives, you manage it, with the end objective being whatever it's going to be, whatever that outcome is. But I think the most important thing is that, one, I think that, and this is something that University of Phoenix talks about, there has been a lack of critical thinking in our society. And I can say that speaking with our country's leadership, speaking with us as individuals, we don't think critically about things anymore. Everything now is about what is best, what best aligns or comports with my own personal opinion and not the facts. And I think it's important. I'll offer this as a chief special agent. I'm terribly disappointed in the fact that there were so much issues for police reform and all of that's gone nowhere. And the reason why a lot of that's gone nowhere is because quite a few chiefs of police and quite a few politicians have decided that, you know what, if I can get away with not making any changes, I'm going to do that. And that's exactly what's happened.
I think that's a good point, because so recently I was teaching physics and statistics. And so there is a tendency to inertia in physics. I think people also have a tendency to inertia, to what is the same, where their status quo is. And that tendency tends to doom us in critical thinking and logical fallacy, and then also progress. And so it really does harm us. And so thank you. Let me get to the next question, because I really want to dig in, because there's some bits and pieces that everyone's talking about and talking around. I can't wait to get to really the meat of these questions. And so feel free to answer to the depth of some of these things. I think that's what people really want to hear, is what's happening. So, and then the next question, and I'll start with Dr. Brinkman. How has your approach to your leadership styles changed or adapted as a result of these times? Can you give us an example of a time that has challenged how you approach the situation or the outcome?
Sure.
So if you had to change, go ahead.
Thank you. My leadership style has changed to transformational leadership, where I'm encouraging the employees to strive beyond their expectations to meet the vision of the hospital and the change in the individuals in the system. The pandemic challenges are met with and addressed by improving the outcomes with different activities. One of the activities that we used was asking the employees to complete an employee survey so that we could find out as leaders what was important and how we could strive to support them and serve them as a team in healthcare. And one of the examples of the challenges that I think we did in the hospital was in 2020, we furloughed a lot of non-clinical health staff members. And I was one of those. I was furloughed for 4 months. And some of the tasks were not completed, such as compliance, privacy, risk management, quality, were not taken to the level that they had been if we had been there. So then in 2021, they have not furloughed any of the non-clinical staff members. I think they realized the importance of keeping everyone on board. One of the first activities that we do when we to improve the challenge of the pandemic was to ask the employees, like I said, to take that survey. And then another one was to take the vaccination, to become vaccinated, because it was an additional means of surviving the consequential serious complications of the COVID virus. And we were proud that nearly 100% of our employees were vaccinated before the Centers for Medicare and Medicaid came out with the mandation that all employees in a healthcare system have to be vaccinated, especially those healthcare systems that receive money from the government. So, and then they were able to give us a booster by September of 21. A third thing that we did was to keep the lines of communication open for the patients. so that they would take a serious role and be comfortable in their role of treatment and recovery. Another thing was to follow the infection control guidelines by wearing masks and shields and gowns and gloves, by social distancing and by hand washing with the proper hand hygiene technique. And then one of the best things I think that we did was develop a labor task force for the hospital of non-clinical staff members who could help on the clinical floor when there was a shortage of clinical staff members.
Thank you, Dr. Brinkman. And I know that I've worked in hospitals where we had to do those things before too, and it seems a little penny wise, pound foolish in those approaches. So thank you. Reggie, I wanted to ask you, because I kind of want to go back around. And so I want to ask you, so as your approach to leadership changed with all these crises that seem to be coming to society right now and the different aspects, and is there a challenging situation where you really had to kind of really test your leadership approaches?
I guess I'm one of those situations where I'm one of those people where if someone's not shooting at me, someone's not trying to kill me, that's really not anything less than that is not a crisis, no matter how bad it is. Now, of course, obviously, it's a crisis for those that we serve and those who are our constituents. But I continue to learn and grow. I don't believe that management is no longer a science that it once was. I believe that management now is nothing more than another effective tool that is in your toolbox to facilitate the growth of yourself and your organization. But I think probably the most tumultuous situation that I've had to deal with was the loss of an officer. An officer was shot, killed. He was shot and killed 13 times, shot with his own gun, took his car, and having to deal with a very angry and very determined SWAT team once we located that subject. And they wanted to go in and they wanted to do what they do as a SWAT team, go out and extract or take out that person, as the case may be. And there was a lot of anger. There was a lot of upset. There were a lot of people who had some dark thoughts. And those were tumultuous times as far as trying to get them to come back to a certain point and focus and realize, okay, there's a mission here. And what we do on the front end affects what happens on the back end. But I've also dealt with change in organizations. And my current organization, where we have a good issue is the election and the allegations of fraud and whatnot that our agency is involved in. And there are a lot of people and a lot of agencies that have a vested interest in what we're doing here. And sometimes you've got to make decisions and do things. While I can't speak to specifics, but I can certainly tell you that that is nothing more than an exercise in tumult, an exercise in chaos, an exercise in trying to get to the facts and not pay attention to all the noise. So I think that if nothing else, your leadership style should be consistent, regardless of what the challenge is. The problem, I think the issue is that not whether or not you can change, but whether or not you can adapt and maintain some consistency. That's what it has. I mean, yeah, there may be techniques and medical practices that change, but the basic concept of nursing and healthcare provision or police service is that you deal with the issues that are before you in the context of, yes, we know what our protocols are, but we're dealing with some things on an individual basis. And that's what you have to do. It's like building a house, one brick at a time, one cinder block at a time. And I think that's the same way sometimes of dealing with things in tumultuous times.
Right. Thank you, Reggie. I can appreciate that because when I teach leadership to my students, I make sure, are you preparing for a crisis? What crisis have you anticipated? Have you imagined some of the worst case scenarios? Because if you haven't, then I don't think that's good leadership. We have to be prepared for these things, and we have to be prepared for these things when they come across, not just when they happen. So,
Chris, I'll say one thing. So I had a cousin that played football. He won 3 Super Bowls with the New England Patriots. I used to go to practice and watch them. And one of the things that the coach would always say at the end of every practice, he'd get them together and say, you know what? We make our own breaks. We make our own good luck. We practice for tipped passes. We practice for fumble recovery. We practice for disastrous play calls. And I believe that that's how management has to work. Hospitals prepare for the worst case scenario. Police departments prepare for the worst case scenario. We as a society do. And so I think that what happens is that we have to understand that managing the basics on the front end can lead to us being able to better manage the complex issues we may face on the back end.
All right, I appreciate that. Dr. Tucson, have you changed your approach to leadership during these times, or have you had some particular challenges that have really affected you in your practice, and even way that your interactions with your students? Because I think that's even critical, is some of these kind of new experiences for those minds coming up and trying to learn from your experience and learn from what you can teach them. So I'm curious to see, what are your thoughts? And it's okay that you're muted. It's just part of our.
Yes, Reggie's correct. And I can tell you from teaching at community college is where the jump off point starts into career pathways in our country. And I can tell you that my students, when the starting point, the match that lit it was George Floyd. And so I'm teaching transformational policing, which transformation I created in 2016. I talk about how police are being the attack now. And then a lot of the students says, well, everybody's against police in society. Reggie and I can both tell you that it's been like that for as long as we've been in policing. It's not a new phenomenon. It's just come to light a lot more now with what has occurred. And one of the most difficult leadership tasks I have had is to convince the students that, hey, in law enforcement, we are bound by oath. How we perform is by oath. Are there a few bad apples? Absolutely, unequivocally. There always will be. The police, when I go to train them, they bow up. Why is everybody in society against me? So just imagine me teaching a bunch of police officers in a classroom with a bunch of community members right after George Floyd. Got to tell you, that was a challenge. And that was something that I'll never forget. But I was able to get through it, because if you talk about education and academic training, you combine the two. A lot of the law enforcement guys weren't feeling it because they didn't feel they did anything wrong. But the community member says, hey, we've got to bring this together. We've talked about community-based policing for years, but Reggie will tell you it's been a nice talk. Now we have to do it. So trying to balance the training today, the education, the police reform is a part of it, which is what transformational policing model is all about. And I gained that from the President's Task Force, final task force report in 2015. And I remember when President Obama put this team together, Reggie and I both were getting calls from the panels that were in Washington, D.C., putting this together. So we had front hand and frontline interface with it. And I will tell you, you always lead from the front. You always lead forward in the foxhole. So when Tilly made her statement, I was with her, and I had to make that decision. And I know Reggie's had, but I would go out in the streets with my officers, even though I knew I'm the chief of police. I didn't have to go anywhere, but I would go out because you lead from the front.
Okay. So Tilly, can you talk more about that too, and some of your nursing practice? Thank you, Dr. Thompson. So.
Actually, thank you. If you don't mind, I was going to change it a little bit because I want to also make sure that while I have the nursing background and I've been leading always with the same type of mechanisms that I used as a nurse, because I've never forgotten those. I'm actually an administrator at a community college, so I oversee all the classrooms now, right? I oversee faculty and which classes are being offered, et cetera. And I totally agree with Dr. Tunson and also Mr. Grigsby, when you said earlier, it just really touched me. I wrote down for myself about leadership and how, what have you done or not? And I wrote down, I have not changed, but I've actually adapted to changing times. And then, Mr. Grigsby, you said that exact same line. I thought, boy, we're really channeling each other here together. But I really love that because for me, a lot of it has been, I have always been a transformational type of leader where I've always asked people, hey, anything's possible. Bring me your solutions. Let's work it out. Let's see where we can find funding or whatever it might be to get there. And in the first 12 months of the pandemic, did that really change? No, it just changed to me doing a little bit more of three things. Listen a little more, and listen a little more detailed what they're really trying to tell me. So I've just had to re-listen. Those were things for me that I really felt. And then as we became in this type of virtual environment, you lose some things that I can't see that body language in front of you. I can't really feel what you're trying to tell me. So some things were lost in translation, I believe. And over the last 12 months for me, I have really noticed a whole new change in individuals that now kind of forgot what we used to do pre-pandemic. So there's a whole new world of having to re-educate people. And I'm just going to talk about like faculty and students at the community college level. All of a sudden, it's before we wouldn't really want to think about teaching online at San Diego City College. It's just community college. And now everybody wants to teach online, but not everybody wants to come online. So there's kind of two sides to that as well. And it's not for everybody, but there's some things that have been very great about it. And so for me, some of those things, I feel like I'm having to work with retraining individuals, what they already knew, and just reminding them. We're coming back on campus more and more. And when you're coming back on campus, I'm finding those meetings, people are really understanding each other a little bit clearer than they did in the Zoom. There was a lot of miscommunication. So I would really probably say for me, it's not that I've changed my leadership style. It's just maybe I've had to get in there and try to figure out what is it that my team needs from me that I can try to help them to get there. Christopher, I don't know if that's really the question that you asked of me or not, but that's kind of where I was going to go with that right now.
No, it is. I think it all is parenthetical to the whole concept that we're talking about, and so just your process of adapting is critical. And I think that the whole world found out that how rigorous online education is in 2020, where everyone thought, oh, this is easy, no problem. Guess what? We knew as Phoenixes that it wasn't that easy, but the rest of the world just figured it out. Yes, Tommy, go ahead.
Chris, real quick, I have to, Tilly couldn't be more right, but I have to say, I'm in the classroom now. One of the biggest challenges is getting them to come to class on Canvas online. Oh my goodness, and unfortunately, and Tilly will tell you, unfortunately, those that come to the Zoom sessions when they're voluntary are your A students. Those that don't come to the Zoom session, they may pass, but they're not going to be A students. That's a challenge.
Mm-hmm. And those are all real challenges. I taught high school, and I was teaching math mostly online, and it was really hard. It was it was really hard. So, Kevin, what have you adapted to? What has changed with your leadership style, especially during these last few years? What's going on?
I think I empathize so much with what Tilly said and then the rest of the group. For me, it's really, I've always considered myself a servant and transformational leader. But sometimes we say those words and they hit all the buzz categories, but there are other times where are we really coachable? And I have a situational example. So I remember training a young man in clinic, and it was very fast. And I'm a very fast person. I learn very fast, and you should be able to follow and keep up. And when the demand is crazy, come on, I need you to get it. And so oftentimes I think I create an environment that's safe where people can express themselves and explore things, but I also move very fast. And sometimes people get intimidated by that. And in this one instance, I remember my trainee not really being able to keep up, and me just kind of asking and asking and asking again, like, hey, what's going on? How can I support you? Where do we go from here? What's next? What resources do you need? And then after a come to the altar type of moment, he kind of revealed like, hey, I don't feel comfortable expressing that because you move so fast and I don't know how to ask anything or say anything. And then from there, it kind of just sent my antennas up, and I had to realize, oh wait, I still have to be coachable. I have to take a step back and realize that everybody doesn't process the same things that I process. And in doing so, it kind of led us to a deeper conversation about how I can change. And oftentimes when I say I'm a servant and transformational leader, that's where my bias is. I know I'm doing the right work, but how can I improve on that work? And so he's taught me a lot about myself. I've definitely been able to improve. And in doing that, I've instituted more huddles, more times to talk, an open and inclusive environment that, he can say anything, and just reiterating and supporting him that it's not wrong. Nothing is wrong that you say as it relates to the work and how we do it. How do we improve upon it? So I think that I've definitely improved. I don't think I've fully changed, but I think I've improved my style.
Kevin, I think that gets at your authentic leadership. And if you haven't taken that class in MHA, I'm plugging it because I teach it. But if you haven't taken that class, it really gets into what you're saying. I think that leadership is really a relationship of influence, of mutual influence. And if you believe that, then you can be led, and you're being led by someone that you're trying to lead, and that's critical. It has to. There's reciprocity. It goes back and forth. And I think that only a true leader, a person that is a leader, recognizes that, versus someone that may think they're a leader but are not, because they're not willing to be influenced by others, not willing to be led. And so I think that's pretty critical. So let's go into our next question, if you're ready. So we'll start with Dr. Brinkman. So how do you maintain or support morale during challenging times? How do you address those challenges or concerns? And how do you maintain positivity with your team? Please share examples.
Well, I think first of all, support of the employee in these challenging times has to be to show appreciation for the phenomenal work that all the healthcare workers have done, from the doctors to the nurses to the allied health staff to the leaders in administration. Employee morale concerns and challenges are addressed to maintain positivity, I think, in three ways. One is to encourage the employees to take time for themselves, to recharge physically, mentally, and spiritually. And another one is simply to care for the caregiver. Take time to take care of yourself.
Mm-hmm.
And the third one is to use interpersonal communication between yourselves to share ideas and information, just like we are doing today.
Right. And so anyone else for that particular question? Tilly, please.
Yeah, thank you. And I agree with Dr. Brinkman. I was really thinking about acknowledging people and saying just thank you. So one of the things, and remember, I'm in California, so the world is a little different here in California, for those of you who've been here and taught here as well. So in my college, we have
Sorry.
So for the most part, we were in a shutdown mode in California in our college. We were not coming back. We were coming back, not coming back, and that caused a lot of issues with our employees and our students. And one of the things that it was is we were supposed to come back January 6th. We were ready to open the doors, and then Omicron. So we decided to suspend it for a short period of time. And our district decided, okay, it was going to be a soft opening on February 22nd with a hard opening on March 7th. So we came in with deciding we're going to do a welcome week. welcome week back to all of our employees. We had taco trucks come on campus. We did free Starbucks. We did all these great things, which was wonderful. But we were also trying to figure out another way that we could welcome people back. It's a very simple thing. I brought with me today is just, it's a little packet. It's a little welcome packet. And we just said, like, your campus ready. We took these large Hershey bars, and it says on there, we missed you, with our logo. On the back, it had different sayings. For this one, I'll just read for you if you don't mind. Indeed, all the great movements for social justice in our society have strongly emphasized a love ethic, by Bell Hooks. So we took these different things, wrapped them up individually with hand sanitizer, gave them out to employees. And just the acknowledgement of being together, the camaraderie, trying to do it safely, of course, and all those types of things. People keep saying, so are we going to do that like once a month? And that's what it's leading to. We are doing a once a month, trying to get people back in, because we've been separated for so long. We have to remind ourselves how to be together again. So I don't know if that's just for me, one of the things that I wanted to share. And when Dr. Brinkman started talking about that, I was like, oh, this is perfect, leading into our little giveaway, just to go out and have fun. And one of the things that I've learned with myself and my team is I have a team. Ask them for help. Why not? Why was I trying to do this all by myself? And I don't know why, but I tried. And I have these great people that are here to help me. When I asked them, they were just floored. And then they went out and had a great time. So that would be my answers. Ask for help. It's okay. You don't have to do it yourself.
And I love that answer, Tilly, just because the fact I tell students on teams all the time, like, they're not just your team for that team assignment. Ask if someone knows PowerPoint or APA better than you, please ask them. It's okay. So, Kevin, I know you had something to say. I want you to weigh in, and we'll go to Reggie.
Yeah, no, I think I agree wholeheartedly with Tilly and Dr. Brinkman. Really creating safe spaces. That's something that I have really been honing in on. And, safe for COVID, but also safe emotionally, mentally, verbally, physically, and asking people what makes them feel safe. And so when we engage in these areas, how do we have these conversations? How do I make you feel more comfortable to feel okay to say, hey, I'm burnt out. The work is too hard. I don't get this concept. I need some support. I need some resources. So that's something that I've really, really, really been enjoying as I manage some chaos, really creating safe spaces for people to be themselves.
Right. Reggie.
Are we speaking specifically to maintaining morale during challenging times? I think that one of the most important things that I have to do, and I think that Colonel Toussaint can tell you this, you got to be careful during challenging times that all of your efforts at solving the problems are coming from the top. Top-down solutions to problems tends to not be received very well. So you want to make sure that you push your decision-making to the lowest level of the organization. But Colonel Toussaint hit on something very important. One, you have to be out in the field. You have to be out in the streets, or you have to be down, whether you're in the emergency room, whether you're on the floor, wherever it is that you have to be so that you can be seen. Because during times like that, people aren't looking for managers, they're looking for leaders. We once said one time that if there was a plane crash, heaven forbid, and everyone in the police department was tied up, or that there was some critical incident, the custodian could go to the microphone, to the podium, and speak to the press and say, hey, they're all busy doing this or doing that, and I'm here keeping an eye. You know what? People will accept that. People look for leadership. But I think the most important thing is that the solution, going back to what our friend Ms. Chavez says, the solutions to problems doesn't necessarily have to come from the person who's in charge. The people who are doing the heavy lifting, the people who are out on the streets, the people who are actually solving problems and doing the work, you have to utilize them and engage them in the process. And the way you keep morale up is that you listen to your people. Like Kevin says, you create that safe space, but you also make sure that they have an active role in whatever that decision-making process is, and they have an active role in making and seeing to the outcome. Because people, I think, and whether you're in the medical field or whether you're in law enforcement or whether you're in the military, we understand that there's going to be challenges. We understand that you're going to be called upon. We understand that there is going to be crises. The thing that we need to do as supervisors, leaders, and managers is make sure we support our people in getting those answers. And then the other thing is that you got to make sure that you rescue the rescuer. I don't know how many times, you know this, Chris, you were in the military, Colonel, you know this. I don't know how many times an officer will knock on someone's door and solve a problem, whether it be a family problem, whether it be a critical incident in the neighborhood. And then when they go home, that same problem comes to their doorstep and they're not capable of solving that problem. And the reason being is that I believe the reason is because we're so used to taking care of everyone else's problems, we're not capable of solving our own problems. And I think that what happens is when we take that uniform off or we close that door to the investigations bureau, we forget about everything we've done and what we applied to get through the day or to help people get through. And then what happens is, you have problems with your kids, or you have problems with your spouse, or, you have a critical incident, crisis with your neighbors or your family. And what happens? You're not capable of dealing with it. And we got to make sure that we take care of the people that are taking care of others.
Dr. Tucson.
One example. We're at Camp Pendleton down in San Diego area, and we're out on exercises. I'm the company commander. I'm a captain. I have probably 110 people that I'm responsible for in my company. So I'm the commander. Well, we have to put up tents. So we went to pitch tents, these huge, big medical tents. We had to put them up. I took off my blouse, my outer shirt, which took off my rank, and took it off. And I was a new company commander. And I'm out there with the others, digging the holes, digging the slit trench, doing everything. And a couple of the guys that were next to me, they didn't know who the commander was. And they said to themselves, wow, what a leader he is. He doesn't know what he's doing. Here we are out here sweating in this degree temperature, and he doesn't have a clue. He's that SOB. Fast forward 2 hours, tents are all up. All the tents are up. The company forms, all 100 of them are huddled in formation. And guess who walks up front but me? And I saw the three young men that had complained about the commander, and they saw me up front. The response was, that's what leadership is about.
Tommy did the same thing in a management course. He and I took a management course one time in San Diego County, a law enforcement management course. He never told anyone he was the chief of police until after the end of the course. And so there were quite a few people who were ranting and raving, young lieutenants complaining about chiefs of police and things of that nature. I picked up right away he had to be somebody because he kept offering a different perspective. But he's done that before, and I think that's a good quality. No one knew that he was a chief of police until the day the class was over. And I think that's a good example of leadership. Leadership entitles you to the honor and privilege of leading, but it doesn't mean that you don't work. It doesn't mean that you don't get out and get your hands dirty, or that you don't sit down and listen to people,
And I think that's a miss by some people. People think so many times leadership is a position, and once I'm in that position, then I don't have to do anything. And it's such a false premise on what leadership is, and because how do you gain influence if you're not there with the folks that you need to lead? You need to motivate them. You need to move in the same direction. And so without that leading by example, without some kind of vulnerability that you give to your followership, you're truly not a leader. But I wanted to go into this other question. Now, I'm going to try to get into some of these more difficult questions, and I'm going to focus on Dr. Tucson and Reggie. And so for the last question, so I was thinking about this in the fact that keeping morale up, but also recognizing, because the next question goes into unconscious bias. And I'm thinking specifically in the case of these last couple years, where all of a sudden we have a spotlight on some of these things that are happening, especially in policing, but it's happening everywhere. So I'm not going to target policing, but because of your close proximity to your career being leaders in policing agencies, how does one work through this at the same time that where people are feeling they're being beat up, they're being um, harmed by some of the political discourse and some of the other things, but how do you keep that up, but also recognizing the fact that there is unconscious bias in all of us and working towards something better? So either one of you, I'll start with you and then I'll work through the panel, but Reggie or Dr. Tucson, whoever wants to
You
chime
know,
in.
here's the thing that I say about unconscious bias. You know, I grew up in Birmingham, Alabama. I'm the son of a man who picked up a rifle and went and fought in Korea. And when he came home, he had to sit at the back of the bus because he was black. He couldn't eat at the Woolworth counter. Here's a man who's in the Marine Corps who stands in line to vote and gets beaten by the sheriff because how dare you, you know, you think that you're somebody simply because you're wearing a uniform. But here's the thing. Unconscious bias is all around us. And unfortunately, we don't recognize it, not because it's unconscious, but because not necessarily because it's unconscious, but because it is so common. Whether you say someone is a conservative or a liberal, whether you say someone supports Black Lives Matters, or whether someone believes in some of these anti-government organizations, or they define a patriot, things of this nature, heroes. There has been unconscious bias in society ever since there has been society. I think the problem is that, unfortunately, people are not listening. There's no question in anybody's mind there's racism out there. There's no question in anybody's mind there's bias. There's no question that in anyone's mind that we are a society that is divided. And we've been that way since the beginning of time. This isn't anything new. I think that what's happened is the last 5 or 6 years have brought it to the forefront, where before it was covert, now it's overt. But at the end of the day, people have to be reminded how things are. People have to be reminded of where they at. Example, had an incident where an officer, Colonel Tucson, the AR-15, M16 is referred to as the black gun. Well, he made reference to, there was a debate about Second Amendment, and this young man makes a comment about, well, he puts a picture of the gun and says it's because I'm black. Well, he had his feet held to the fire for that. Because in the end, when he says, oh, that's not what I meant, but he did say this, I understood how it could be perceived that I was making a racist statement. Well, if you understood that, why did you say it? So unconscious bias, we all have it. We all have it. And this is what I'll say. I had this conversation with some people in my staff last week. I'm reminded of my blackness every day. Not because I look in the mirror and not because I see it, but I'm reminded by what I read in the paper. I'm reminded by what I hear people say. I'm reminded about it by the very, very nature of society and my interactions. When I walk into a room and say I'm the chief special agent responsible for the entire state, people look at me like, oh, what, you're Reggie Grigsby. It happens a lot. How do we deal with that? You just have to call it out. You can't train people. You're not going to change people. I don't care what your mindset is. What I do care is how you act. No question in my mind, there's men and women out there toting guns and wearing badges that are racist. No question at all. And I mean on all sides, black, white, brown, yellow, whoever. But at the end of the day, it better not manifest itself. It better not show itself. Because we all have biases. I know I do. We all do. We're human.
Dr. Tucson, thank you, Reggie.
I couldn't agree more. And Chris, the example I'll give is when I'm in plain clothes and I drive into a military base. In the military, we have the 2 tiers, 2 classifications, enlisted and officers. Officers are the senior leaders that manage the entire organizations. The NCOs or enlisted are the real true heroes in my book that do the work in the military. But when I drive into a base, they look at me in civilian clothes. They always call me Sarge or Corporal. They never presume that I'm a senior military officer, never. And that is implicitly, unconsciously in their mind. They don't have any malice behind that, but they see a black guy coming in until they see my ID card and it says Colonel. They just about toss their cookies when they see that, when they're coming aboard. That's an example of that. But I will tell you myself, you see, I teach it. When I created transformational policing model, I teach unconscious behavior because unfortunately, the incidents that have happened in the United States from Baltimore, from Freddie Gray to, I mean, they keep happening, right? And a lot of it is reactive, not necessarily a malice and malicious act. And so what I do when I teach this class is something I learned a long time ago is you always talk to people respectfully. And the first place I heard about talking to people respectfully was when I was blessed enough to meet Cesar Chavez and talk to him. When I was blessed enough to meet Rosa Parks and talk to her. And when I was blessed enough to meet, and a close friend of mine is Dolores Huerta. And they would all tell me how you treat and respect people is where it's going to come from. That respect has left us, unfortunately, with police community relations. And we're rebuilding it through police reform. And I believe the method to do that is academically through the colleges, primarily the community colleges. California is coming up with a new law that requires police officers to have a bachelor's degree. Do you know who's not going to become police officers in the future if we have bachelor degree requirement? People of color. Whether we want to believe it or not, that's who's not going to be. Why would you, after going through what you went through, get a bachelor's degree and then put yourself subjected to policing? We're working on a modern policing degree, a 2-year degree, and I know Tilly's familiar with this, that we're trying to put this together and hopefully work that out. But I think, Chris, that is how it's going to be. That's why the tumultuous times have happened. I talked to the interim Ferguson police chief when he went there. And Reggie, you know, Andre Anderson went there as the interim
very
chief.
well.
Okay, and Chris, you might know Andre as well. We talked right now, he's at Tempe with Jeff Glover. So we're looking at that. But again, I like to follow the lead of the hospitals, the nurses, and all the medical profession, how sympathetic they are and how caring they are. I'm trying to get some of my law enforcement officers to convert from warrior to guardian, which truly the medical field, the nurses, the doctors, they are guardians of society. And I want law enforcement to become guardians.
Right. I can appreciate that a lot. I actually taught in the Ferguson Florissant school district back in 2021. And so it was interesting just to interact with the students. They, Mike Brown was very, very right there in their psyche and talking with the students, asking about their expectations. And that was the expectation. Mike Brown's experience talking with my students who were taking AP calculus. So these are very bright students, but this is what they expect, young African American men, and that was shocking to me, just to learn from that. And so, Tilly, I'd love to hear what you're doing with, especially in nursing, in hospitals, around unconscious bias and how that's affecting your work. But what your thoughts?
Well, thank you, Chris. I was just going to share. I really and I appreciate just being here and being part of this team today, so that I just love listening to what we're all saying here. And the Colonel, I couldn't agree with you more. You took me back to a time when I was a bedside nurse, and a younger nurse at that time, but I had a patient who, you know, she was about 80 years old. At the time, for me, as a young woman, seemed old. As I get closer to that age, it doesn't seem so old to me anymore. But she had made a comment. It was a Caucasian Jewish woman, and I was taking care of her in an ICU, and she really was trying to hint around to my ethnicity. She asked me if I was Italian. She just kept, and never really just came right out. And I just said, "Ma'am, are you just trying to ask me, what my background is, where I come from?" And she said, "Well, yes." And I said, "Well, just to let you know, I'm a Mexican American." And she looked at me and said, "I don't believe that." And I said, "What do you mean?" She said, "You are too clean to be a Mexican. I should know I have one that works for me." And I couldn't have been more than about 25 years old. taking care of this woman. She's in critical care. For some heart issues and what have you. I just kind of think I thought about what Mr. Grigsby said, you got to call it out, but I was careful about it. And I just said, well, ma'am, I can assure you that I am a Mexican American. I'm also a registered nurse. I'm here to take care of you today, and I'm going to do everything I can to give you the best care I can. So I walk out of the room. All the people had heard it in the room. So they're all coming in saying, I'm going to take that assignment away from you. I'm going to take care of her. All of a sudden I find myself being her protector because everybody else wants to take care of her in a bad way, not a good way, right? And they just looked at me and said, I said, it's our job to take care of them. She just doesn't know any better at this point in time. But by the end of the day, she's going to get to know who I am and that I'm here for her. So I kind of thought about that right now as you were talking, because I'm going to bring that into my current role as an administrator. First and only Latina woman, which was hard for me to believe and still sometimes hard for me to understand that concept. But I'm also on a team of nothing but men. And at times I have to remind the men around me that I need to get in there too. So, and I call it out. Did exactly what you said, Mr. Grigsby. I call it out and I'll tell my boss and I'll tell my colleagues, hey, are you guys not listening to me for any other reason? And then we'll just sit back, we'll talk, and it kind of changes the tone of the room. And then we do almost exactly what, Chris, you're doing here today. We go around the room and everybody has a say in it. So it does make a change in those times. I also use that and try to help myself to lead into all of my departments in the academia area too, right? Nursing has been one particular one that I've been working really carefully with in the last 24 months. Can they get out to clinical? Can they not get out to clinical? What's safe, what's not? We put ourselves out there to try to help in every way we can. And then they come back and have we had some COVID exposures? Absolutely. I think most people have. But they come back and they're like, well, we got a little sick. Now we go back out there again and keep going back at it. They were one of the first ones that said we cannot be the online individuals when we're trying to do the clinical. Right, clinical is a little more difficult to do that. There's some simulations that are really pretty good at that. But they really came out in the front and said, this is how we have to change things, Tilly. So it's really been more of that piece of bringing it out open in front, have that conversation, and be respectful of each other and just listen. I think for me has been one of the biggest things. One other issue for me is, and I'll be the first one to tell you that I do have an issue at times. I have an issue with equity versus equality. Everybody will come back to me and say it's not fair, but are we doing equality today or are we doing equity? And so that is sometimes an issue for me when it comes to the unconscious bias too. I think it's just something, not sure that I really want to throw it in there, but just to say it's something that always comes in that I was brought up as everything's got to do this for this and this for that. And so sometimes I have a tendency I cross over the line in equality many times, and I kind of remind myself to go into equity. So that's just something that I have to do for myself, and I remind myself of that every day.
I think that's a perfect statement, because I think that goes into what the keynote speaker was saying this morning about people being born on first base with someone about to get a home run for them. I'm bad with quotes, but I can get it because this is what I believe in through my research, that people aren't born equally. And it's kind of a myth that we go around, we think, oh, everyone's equal as long as they do this, but that's not true. That can't be true, because then we would have equal outcomes. And so it's the truth. And so, Kevin, I want to ask you this question, then I'm going to ask you another question. I'm going to give Dr. Brinkman also a chance to, if she wants to weigh in on this. So what have you dealt with unconscious bias, especially during these times, and how has that influenced your leadership practice?
I think I struggle with this question often, just because there are so many terms to kind of highlight DEI, right? And then also looking at what unconscious biases is. Am I looking at it from my perspective? Am I looking at it from things that are being done to me or populations that I support? for me, I definitely carry being a Black male in America with me, and then also a Black male in healthcare, which is kind of, a very niche population, like I would describe it. And so for that, oftentimes I kind of am laser focused, like, this is the area of the realm that I need to just hone in on and bring that into all of my practices. But as of late, I've really had to take a step back and address my unconscious biases and really ask my teammates, let me listen to what else is out there. Let me explore and understand really, like, yes, I have my perspective, and I think it's still a population in greatest need, but also as I do the work, I have to make sure that we are equitable and everybody has a chance to speak, and how do we serve everybody, and then take time to really highlight each of those populations with the resources that we have available.
Thank you, Kevin. And Dr. Brinkman, I wanted to ask you if you wanted to weigh in on unconscious bias.
Sure. I enjoyed listening to everyone. What really resonated with me was Reggie's comment about we all have unconscious bias, just don't let it show. And in the hospital, it's very important. Um, patients have rights, and we put posters on the wall that say patients' rights. And these rights are dictated by the federal government. And we read these rights to the patients, and we give them copies of the patient's rights. So, we have to respect patients, and that's what we're all about. Patients are our customers. Patients are why we're all in business, the reason we have jobs. And it doesn't matter what color you are, or what education level you have, what kind of a job you have. When you're in the hospital, you are vulnerable, and you are our patient, and we cannot have a bias. And I think bias, it's you just have to learn. Sometimes people have told me, or maybe you have a temper. Well, my mother used to say, you need to control your temper. I think you need to control your bias. Sometimes we are brought up or brought in an area of unconscious bias, but we have to learn to control it, and we have to learn to respect patients. In risk management, deal a lot with patient complaints and concerns, and I'm the patient advocate. So I often listen to the patients. I think somebody said that earlier. Just listen, 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 because don't just consider, just because maybe they're here for being a drug abuser, that they don't have something really wrong with them. We have to treat them all as if they're all sick and need help, and treat them with respect.
All right, I appreciate that, Dr. Brinkman, and I think that's the key and critical, and especially as my work in healthcare too has always been about putting aside some of our biases. And I've worked in a state hospital before, and I remember really putting aside some of the crimes that the individuals committed as part of their plea guilty except for insanity. And so really setting aside that and giving care, especially to some really tough things. And I know that we all experience that. And that's a segue into this next question. And I'm going to start with Kevin, just because you're in the MHA program and it focuses on empathy. And so a lot of that in leadership is turning our perspectives and sitting in the chair of those that we serve. Coming from that perspective, and also being an empathetic leader, really putting ourselves in the place of those that we need to lead, and not seeing ourselves as separate or different. And so empathy, how does empathy flow into your leadership, and how do you use that, especially when we're dealing with tough stuff, with tough stuff external to the workplace? So whatever is happening with individuals, their families, their struggles, and giving empathy and care to the folks that we need to serve, are also serving those folks that we do serve. So talk about empathy, please.
So I always consider myself an empath too, and I carry a lot of my experiences with me. I remember, if I'm engaging with anybody, I always think about, what if it was me? You know, I could be on the other side of this conversation, and I've been there. You know, I've dealt with some patients in very critical moments. For instance, I had someone come in and she could not manage her diabetes, and it just was horrible. But she was a frequent flyer in the ED, and so we had to use a lot of resources. You know, people started to complain because she was taking a lot of time. And then, you know, I just remember also my own grandmother, who was a nurse, didn't have enough resources at one point in time to manage her own asthma. And so it became a thing. And I remember going to the ED with her often, which was miles and miles away. We were living on the north side, and then we were going to Rush University. So anybody who knows Chicago, that's not an easy track at all, especially at like 10 o'clock at night. And so with that, I always keep that in mind. Like, you know, you never know what somebody's situation is. And then from the perspective of someone who has the ability to help and care, I have to remember, this could be me, and the way I want to be treated should be the same for anybody that I'm supporting. So I always try and keep that in mind, and then I always try and remind others, you know, yes, this is tough. Yes, this person does not match the norm of who we would want to see potentially, or this just makes no sense. But also remember, this is a person. This is somebody's loved one. This is somebody who deserves respect and dignity when they're seeking out care. And just imagine if it was you and these circumstances were yours. So that's how I always lead from an empathic standpoint. And then, I think that says it all for me.
I appreciate that, Kevin. Tilly, I have a question. I'm going to spin this a little bit different, because we've been hearing about this, especially with our healthcare workers and nurses, empathy burnout. Those folks where we're trying to be empathetic to everyone that comes in to our care, but at the same time, you're like, gosh, will you stop? Will you stop sharing this great disease that keeps on sharing? Can you quit? So please tell us more about your perspective. How do you leverage empathy, but how have you had to keep empathy up through the people that you're working with? And I know that they're drudging through the process, and they're seeing harm in 3D right in front of them. But how do you do that?
Well, Chris, what you just stated is so true. It's real, right? It's real of having, boy, you took me back to spaces where I haven't been to in a long time, where I actually felt that way myself, where I just don't know if I can face another moment of this crisis that we're in, right? Either currently or previously that I've had to deal with. And recharging is important. It is really important for people to step back, take a look. One of the things that I was really kind of concerned about when kind of reviewing and thinking about this was, what about the issues that I'm not too sure about? I'm empathizing, and I think I'm getting to what you're asking for and needing, but did I really get to the foundation or the core of the issues that people are having? So I also have some concerns that I'm too narrow focused of where I am, and I'm spending all this energy and time here, and I'm not really focusing on other things that I could be helping even maybe the greater good with. So that for me is also a bigger issue on that piece of it. But it's really important, just like any type of burnout, it is really real. It's real to be able to step away, step back and re-engage yourself. How do you fulfill yourself and what's good for you? And I think it's changing times, what works for you, what doesn't work for you. I've recently, for my own self, have felt that point where, oh, what a great vacation would do for me. Oh, wait, I can't really go on a vacation right now. I don't feel real comfortable for myself to go on a vacation. So, oh, that's not happening. But what has been happening for me is some really moments of centered self, and really meditating just for myself. And actually, I call it Tilly time. I hate to say this because I know leaders are not supposed to say these types of things, but while I never take care of myself, I take care of everyone else but myself. And this Tilly time is 10 to 15 minutes every day for myself, which when I first came to try to do this a few weeks ago, the guilt came over me just to take 10 or 15 minutes for myself. I have a cousin that for some reason gave me a singing bowl. I was able to take to it very quickly, and I make this bowl sing. It just helps me to focus my own thoughts, my own energies. And so now what I'm starting to do is to work with individuals, my team, others, especially healthcare workers. This would be a great time for them to just try that self-centeredness the best they can, because they give and give and give, and actually gets to a point that, like you said, stop. I can't take it anymore at some point in time. But I think that's pieces of that. I also try to remember back 24 months ago at the beginning of the pandemic, when you started to see on television, people were having concerts from their balconies. People were just enjoying life the best they could. To me, that's also tapping those methods of being able to reinvigorate ourselves for that empathetic self again. And sometimes maybe going back 24 months ago isn't the worst thing, to see some of the things that we did as a society as a whole. Some things were really good. Not all, but there were some things that we can pull out of it. So that's just for me right now, where I'm looking at that and trying to prevent the burnout, because I can just tell you there's some times where I have peaks and valleys that I, just like anyone else, that I can find myself low and have to find a way out. And that's what I'm doing now.
I can appreciate that too, because as a teacher for the last 3 years, I've had a lot of teacher guilt. And so I've done a lot of things out of that guilt that weren't, I didn't have Tilly time. So I appreciate that. So Dr. Tucson, I want to know specifically though, how are you communicating the importance of empathy to what will be our future law enforcement? What would be these students that are really learning this practice and this art of what you're teaching them, especially in criminal justice and law enforcement, but also going beyond that? How important is empathy in your practice of leadership, but also what you're trying to communicate to these next generation of law enforcement professionals?
You know, what I do is I balance and align concepts with today's activities. When Freddie Gray happened, when Alton Sterling happened from Louisiana, when Dante Wright happened, what I would do in my criminal law class is I would align the elements of a crime and then explain to them, you're quick to call the police murderers and that they killed people, but if you look at the elements of the crime, they're not there. Then I would align in my transformational policing class the incidents that happened that were questionable or not questionable. And I talk direct to them, I talk straight to them. And I let the law enforcement officers know, listen, it's not you personally. Do not take it personally. It's symbolism of what has happened in America. And I go through an analysis of, we basically have 305 years of distrust that we're trying to overcome now. The nationwide discussion is just that, from slavery to affirmative action to Jim Crow. All of these are distrust. And I tell the students, do not give up. This is a proud profession. It's a noble profession in policing. And we're going to get through this, but you've got to believe in yourself. And like what we always say as leaders in policing, if you're doing the right thing, do it for the right reason and do it all the time. You never have to worry about whether or not you have a body cam. You never have to worry about if somebody has a cell phone video. That's what you do. And I talk very positively. I align the goodness and honorable ethical behavior that is law enforcement, and that we move out and we try and do that. And I really believe that a lot of them, and I take time because I have, if you can imagine the typical, Reggie can relate to this. I don't know if the rest of you can, but the typical SWAT officer with the military style haircut, the blonde hair and the blue eyes, standing tall, and comes to me and says, listen, I appreciate what you're trying to do, but this isn't me and I'm not receiving this. A week later in the class, he comes to me and says, you know, I get it. What you're saying aligns with my training from the academy. And he says, to be honest with you, my upbringing I grew up in Alabama and I moved to California. I just got to tell you that the way you put this out, the way you showed the empathy and understanding of both sides has made this a very well put together training to help me in the future of law enforcement. And I'm glad I took this training.
And I can appreciate that because I think it's critical to have leaders like yourself as change agents to help, others realize their potential and see their path ahead. And that's what we need is it's really, but service is giving back and have others step up and become leaders themselves. And Reggie, I wanted to ask you also about empathy, and how that's working with your practice, especially with what you're doing um, in Phoenix law enforcement, and how that's communicated to the officers out there and your work out there.
Well, I think when you're speaking about being empathetic, the most important thing is that means that you're willing to walk a mile in that person's shoes. Now, I think that one needs to understand that when you put on the shoes of those that you work for, I never like to use the words that, people work for me, but for those you work for as a manager, as a leader, you can put on their shoes, but you still have to remember, you still have to walk in your own shoes. And so that means that while you are being empathetic and you understand whatever issues of accountability, whatever issues of training, whatever issues of organizational, administrative action that you have to take, you take. But when it comes to things like one's well-being, we have to be empathetic to the fact that, we have agents, we had a matter here where we had 60 agents that were pulled off all of their cases and they're working full-time on one matter. And some of those people are working 6 and 7 days a week, 12-hour days. And you have to be empathetic to what it is they're doing and what doesn't get done that falls by the wayside when you're making such a massive effort. So empathy to me basically means that you prioritize. To me, being empathetic means you prioritize what it is that you need to do to make sure that those who are serving are taken care of. That's what empathy means to me. Okay, if I've got 70 agents and they're all close to burnout and they're dealing with issues, just like Chili said, there's some of them. I don't want to go. I don't want to leave. I don't want to go on vacation. You're going to take 3 or 4 days off, or if you don't, then you're going to get a fitness duty evaluation because you're not joking, you're not laughing, you're disengaged socially. So those are the things that we have to do. But empathy, to me, it means prioritizing the things that you need to do to make sure your people are taken care of. Because even a person who's wrong still needs empathy. Doesn't mean they get off the hook, but you have to be empathetic to what people are doing sometimes and the decisions they make.
And I can appreciate that too, because that's something where I always do. I always try to align people I disagree with. I try to put myself in their shoes and try and just give them positive intention. That's not always their intention, but if I can do that, that helps me work with that individual that we disagree with, and we can keep moving forward and keep going. So, Dr. Brinkman, I wanted to ask you about empathy, and I know we only have a few more minutes. We have 2 minutes left, and I want to
Okay.
get some other questions. So, please.
Well, I've been thinking about what I think about empathy, and there's one word that I think sums it up in all organizations, and it's culture. The culture of the organization has to be empathetic, and it's very difficult to work in an organization that's not. I think in the pandemic, one of the things we see is that employees have prioritized, like Reggie said, prioritization. They've prioritized things differently. They sometimes have a conflict with the organization because they no longer are so empathetic towards the organization, or maybe because of the culture of the organization, they were treated more fairly. They have a good a good outlook on the organization. I think organizations have to show just culture so that in the culture that we're in, that we're treating people fairly and treating people empathetically. I think that's culture is the word I think of when being empathetic.
And I think that that's really the key to leadership. We can establish and set the stage for a culture to be inclusive, to be empathetic, to do a lot of the things that we've all talked about today. And so that's really the key, I think, for leadership. And also, Dr. Brinkman, go ahead.
There's one more thing I thought of and I forgot to mention. I think that the University of Phoenix is very empathetic. It has a culture of empathy because they care about the patient or the patients. They care about the students. I have two roles, patients and students, but they care about the students. They want the students to be successful. They want the instructors to work with the students to be sure that they are successful. So I think that the University of Phoenix is a good organization that has a good culture of empathy.
Okay. Perfect. So any last words, or are we done, Casey?
Any last words? Go ahead. You're good.
So any last words from the panel, please?
I'll just say this. Words are meaningless. Action speaks louder than words. I can tell you that I work in a Republican administration. I am not a Republican. I can tell you that I work in a Republican administration, and I support some of the concepts behind Black Lives Matter. I support some of the concepts behind things that traditionally have been embraced by people of my race and my ethnicity. And interestingly enough, I can say that and not have any fear of repercussions because my boss, the Attorney General, is a person who's an ethnic minority. So his country fled the former Yugoslav Republic years ago. And when you tell people that, just by being someone with a different background in a position like that, it makes all the difference in the world to people. So I think sometimes the people that we elect, the people that we appoint, the people we choose, the people we promote, just that promotion itself can say more about you as a leader, sometimes more so than it can say about the person you promoted.
Absolutely.
Little pitch. I put my email in the chat box for everybody. If there's any questions, I'm coming to Tempe, Chris and Casey, probably within the next 2 months to teach transformational policing to Tempe Police Department and quite possibly to my friend from California, Jerry Williams, the chief of Phoenix. So I'll be stopping in to do that, and I'd like to invite all of you.
You better bring lunch over here too. They'll be buying lunch. They'll be buying lunch. I ain't going for that.
And officers always buy lunch. Okay,
Yeah.
and I am no exception. But thank you, Chris, for this opportunity, and Tilly, Mary Jo, and Kevin. I'm honored to have been in the same room with all of you. And I will end, Chris, by saying something a really good friend of mine says, and that's "Si se puede." Yes, we can.
And there we go. So thank you. I don't know if anyone else has something to say, but I know we're out of time. And so I appreciate everyone today. I appreciate all your thoughts, all your energies, and all your efforts. Hopefully the everyone that was listening gathered something from this, and thank you so much.
Excellent.
Thank you.
Thank you all for joining today. Now is the networking lunch hour. So when you go back in, you can go to the networking session as you want, if you'd like. It actually pairs you up with one person just at random, and you can network with that individual. Otherwise, our next session starts at 1 o'clock. So if you want to come back to the main hallway for the 1 o'clock session. Thanks, guys.
Thank you.
Colonel,
Thank
be
you.
in touch.